Hey there, gang. I'm Dr. Steph Gander, and this is Dr. Bob McNeil. He's trying to find something, so we're going to let him do that. While we're letting him do that, today we're talking about Legos. And this is actually pretty cool. This is a set that
We didn't say who we were.
I did say who we were.
Oh, Between Two Teeth.
Hey, we're Between Two Teeth. Oh, Between Two Teeth. Okay. I was talking about my Legos.
Yes.
All right, enough about Legos. So, and we have our flowers from our subscriber that sent us these flowers. Thank you so much. They really do brighten the screen. We love it. Thanks also to our sponsor.
I'm not even going to say it this time.
So what are we really talking about today? I think we're going to do a kind of a tough topic here. It's about failing your boards, which...
Well, and it's about passing your boards. Don't start with the bad side of the equation.
So we're going to talk about our own personal experiences with the board exams.
You go first.
Yeah, real quick for me. So where I'm at, there was a certain examination kind of regionally that was administered, not pointing any elbows. And for where I was going with residency, I didn't know what state I was going to be in, so it would behoove me to take, at the time, a different kind of exam. And, we can put this right here.
You just want to show off your Legos.
I did my Legos. And so anyway, I gathered a cohort of students who were kind of in my same boat, but for a variety of reasons, and we took a different exam, one that wasn't necessarily supported by the school, but was supported by our state. When doing that, we, of course, had a lot of pitfalls, things that we weren't expecting, and personally, I failed my first time. And this was a huge failure, and I thought I was ready, thought I was prepared. And so, needless to say, I went back at it.
That's tough. You failed.
Yeah, I redoubled my efforts. This was it was embarrassing. It was humiliating. Our group went out and we were trying to do something different to suit our own needs, and it just collapsed around us. And so, we redoubled our efforts, and everyone did so much better the next time. But we had to ask for very specific help in a variety of ways.
It's tough when you do it not in your dental school, when you do it in a different facility.
Yes, and without getting too political or going into too many of the things, specifics of it. Nuances of it, just broadly speaking, I'm a better dentist because I failed my first time. And if I had passed my first time, I would not be, my hand skills would not have been where they should have been in order to kind of get out there and practice up to a really great level.
And that's a good point. And so I'm a board examiner with CDCA and with REB, and there's a couple things we see that can be helpful. I think stress management is a huge part of it, and we've kind of talked about different things to help de-stress. That's a big component. Figure out something that's going to help you relax. Maybe it's that 4-7-8 breathing exercise that you can YouTube that helps. Because people freak out, and we'll see that off the very start.
I love your point. I had some of my family members in there. They were my patients for my second go-round of passing boards, and my mom was freaking out in the waiting area because she was like, Steph should be out here right now, and she's not.
And chilling out your patients, and sometimes that's super difficult to do. The other thing is, as an examiner, we work off the candidate guide that you have, and there's criteria in there. It's hard with
criterion.
We've got all kinds of things here.
Don't show me that. That brings back bad memories.
It does. I actually wore a scarf one time from someone's school, and it freaked them out because it brought back bad memories. So
let's get to here. So failure is good, but what do you learn from failure?
No, let's not talk about that. Let's talk about passing. We keep talking about the failure side of the equation.
For me,
look at the guide and look at what's classified as inadequate and unacceptable, and really don't do that. And sometimes at a board perspective, we see people that keep going and shaving off too structure.
You're talking about two different things. You're talking about stress management versus knowing how we're going to pass. I think the reason stress levels get so high is because dental students either don't know, even with the criteria, reading the criteria, and then actually performing it, there's some communication differences there. And so that's one of the stress causers or causative agents. Also, not getting political, but trying to find patients or trying to find...
And that's one of the
right modes to practice.
That's one of the blessings post-COVID. is a lot of the examination community now is going mannequin based. I'm certainly a fan of that. As an examiner, it is so much easier to examine candidates when you're looking at the same, everyone's taking the same
Right.
test, basically.
and
But know the criteria, know what's inadequate per the criteria, and don't go there. A lot of times it's too much reduction, not enough reduction, and the unacceptable's way off
Have you
on
ever
the
failed
edges.
the board exam?
No. I did. And
We both promised we were going to be in a vulnerable space and talk about our failures.
so I did. I had someone used my primary patient the day before, and that patient had to get temporized because that person failed, and my backup patient didn't show up. I grabbed someone out of the perio lineup. He had watched a dental horror movie the night before, and he rips off the rubber dam in the middle of the process. And
Wow,
so
that sounds terrible.
I had to retake.
But here's the thing, because I'm sorry to cut you off.
Are you though?
Not really. But because we both failed, here was the cool part. I was on fire for revamping just our regional examinations, for revamping licensure, and that's a fire that carries with both of us today.
Right.
That was the blessing.
Certainly for me, and going from ASDA president talking about issues with failures and challenges with live patients to now being on the examination side of the community, it has made me a better examiner. It's
Right.
made me a better advocate. It's made me a better dental state board member. And when I think our blessing here is too, if someone's watching this and they have failed the exam, know that you will get better. You can pass it.
And that's my point from this video. And as we wrap up, we're trying to pass first time. We don't want to scar
Right.
anyone unnecessarily, but here's something, a silver lining to take the stress off of it. At the end of the day, you're going to wake up the next day and you're going to learn from whatever happened.
And you're going to be okay.
And realistically, if you do fail, you're going to be
You turned out okay.
you're probably going to be a better practitioner, and I say that lightly, but you're probably going to have better hand skills at the end of the day, because failure teaches us things that success doesn't.
Right.
And I've had some of my greatest successes following some of my greatest failures.
Same. Don't be afraid to fail.
Yeah, don't be afraid to fail.
Practice, practice, practice. Manage your stress. Take a big,
Absolutely.
deep breath. Slow things down. Hit subscribe if you love what
Comment
we're doing.
below.
Comments below. Dental students, we love you. We want to help you. Welcome to the profession. You got this.
You got it, guys. Thank you. Thanks for looking at my little
Great Lego,
lens.
by the way.
Yeah.
We need a bigger table.
We do. Thanks, guys. Bye.